The vestry going okay?
I do.
What we have going on today is we have 28 patients who are ICU. In our normal ICU, we have 12. Out in here, we've made 16 overflow beds for ICU.
Out of those 28 patients, 20 of them are COVID positive, and all of those seem to be on some type of mechanical ventilation right now.
It's all ages that we're seeing, but what we're seeing unremarkably is the unvaccinated are the ones who end up in our ICU.
Imperial County, California represents something of a mystery. It has one of the highest vaccination rates in the state, yet
There is a high percent of hospitalizations, and when you take a look at that per 100,000 population, absolutely, we are among the highest in California.
according to the California Department of Public Health, 112% of Imperial County has had at least one dose, and 84% are fully vaccinated.
I completely understand why we're seeing such high percentages, beyond 100%.
Imperial County is a cross-border community.
We have individuals that work in Imperial County. We also have children and older adults that also attend school. So we understand that they may be here in Imperial County during the day, but at night they go home to Mexicali, Mexico.
Its proximity to the border has added to the challenge of caring for COVID patients.
We've heard that the hospitals in Mexicali were kind of overrun, so they were telling those folks to come on this side, and I think that's what we're seeing right now.
Throughout the pandemic, Imperial County has been hit hard by the coronavirus, often with case rates above the state average, partly due to pre-existing health conditions.
They're here for quite a while. We're talking 1 to 2 to 3 to 4 weeks, and their care is quite complicated,
making an already challenging situation all the more difficult.
So you start out with a county that was already in what I would call carrying the burden of disease, the high rates of diabetes and asthma, COPD, and much more, right? And then we have high rates of cancer. We have poor quality of air. Combining all that together.
What's different about this wave is the age demographic of COVID patients.
People are wondering, you've done a good job with vaccination, but why such high numbers? Well, because there's a new group of folks that are getting affected, and that's the children, which we didn't see in the first or second wave.
A small county with only 2 hospitals, tasked with caring for far more people than the census would count, has strained resources in this rural area.
The biggest challenge by far is staffing. Every day we are figuring out not only how are we going to cover the patients that continue to increase in numbers, but also the number of sick calls, our own staff that's out sick because of Omicron.
We have to shout with all of our voice to try to bring resources down. I rely on every penny from the federal government to actually make me succeed and survive. I need more attention paid to hospitals like ours all across the border of the US and Mexico, but really across the country.